Hi there, I'm Sara Sheehan, and welcome to my podcast, Transformational Thinkers with Sara Sheehan. Today I'm joined by Jeremy Fischbach, CEO of Happy, a frictionless mental health company that is completely disrupting how large organizations care for their employees' mental health. Many of the large organizations that are working with Happy have employees that are in harm's way or in very demanding professions, like military organizations such as the Air Force or the Department of Defense, large hospitals with healthcare workers, including nurses and doctors, just to name a few. By the way, their clients are reaping huge returns on investment. Jeremy is the founder and CEO of Happy, whose mission is to create a more supportive culture by expanding access to the essential ingredient of mental health and by teaching and inspiring people to better emotionally support each other. Prior to Happy, Jeremy was a CEO of Mine, which built interactive, educational, and sports analytics software that leveraged users' psychographic data to improve performance. Jeremy has a psychology degree from Princeton and a JD from NYU.
I'm honored to be here, Sarah. Thank you for making time on a Saturday.
Absolutely. Jeremy, I find you to be a truly fascinating person. Can you tell me a little bit about your backstory and how it led you to where you are?
Yeah, I'm not sure that I agree with your characterization, but I think I've taken the same type of circuitous path that a lot of people have to wherever they are in their lives today. I think for these purposes, my story begins with a deep curiosity about people, which preceded going to college even. I just happened to always be on the outside of any population I was a part of, looking in. And I think it gave me a chance to better understand who I was, who other people were. When I got to Princeton, I majored in psychology and neuroscience and was actually going to be a psychiatrist. I was pre-med and then had a near-death experience right before graduation that sent me on a whole different course. I was a composer in New York City for many years, and then for reasons no different than a lot of lawyers, just went to law school because I didn't know what else to do, and briefly practiced, hated it, and have been in psych tech and now mental health for the last decade, including, the last 4 or 5 years with Happy.
That is a truly fascinating path that you've taken. I'd love to double click on some of the personal trials and tribulations that you've had in another conversation. Tell me a little bit about the story that led you to create your business.
Yeah, so it's a story that I think a lot of people can relate to. It's really a story about a failure to get mental health support at a critical time in life. I was coming out of a divorce. I needed support. I knew there were, and really when I say support, I mean mental health support, emotional support, interpersonal support, as opposed to other types of support sometimes people need coming out of a divorce, like financial resources. I needed interpersonal support, emotional support, etc. And I knew there were two places to get it. My primary support system, i.e. family and friends, where we get 99% of the mental health support we ever get in life, and secondary support systems like therapy. And happy that this company, the movement around it, was born out of the failure of both of these systems in rapid succession. And Sarah, you and I have talked about this sequence of events, but my primary support system failed first. unfortunately. I'm sure a lot of people can resonate with that experience. That looked like me feeling really down, lonely, worried, and just 9 out of 10 calls I made to family and friends went right to voicemail. And if they actually picked up the phone, they had typically nothing more supportive to say than, I told you not to marry that woman. And my situation got worse. I started chain smoking kind of out of nowhere and was having not suicidal thoughts, but cousins of them, like, who cares if I die of lung cancer, which was one of the darker thoughts I'd had. And I really meant that. I didn't actually know who would care. And at some point, I said, okay, this has gotten serious enough that I should try therapy. And that failed for the reason that I would call friction. Namely, it was too hard to get it. I had to be struggling, obviously. I had to be aware of it, which most people are not. They're not even aware they're struggling because we don't bleed when we're anxious. But the signs that I was struggling were conspicuous, like waking up for the first time in my life and needing a cigarette. I needed to reach a breaking point, which I did. And then I had to research my benefits, send out 24 emails to therapists. A month and a half later, one of them responded. Maybe a few eventually responded. Most responded to say, no, not taking anyone, not in your network. So, something I didn't really want to hear, or, you have to pay for this yourself. Eventually, I got to somebody who was taking new patients. Their first opening was a month later. And I had to go through opt-ins and registrations. And yeah, probably 2.5 to 3 months after I began that process, I was sitting in a therapist's office, and she was good. I think mostly she gave me emotional support. She just listened to me and, gave me a little bit of compassion. But mostly, all she said that I remember was just, "I'm sorry, Mr. Fischbach, your time's up." And I just thought, is this what I waited 3-4 months for? Because this is really just emotional support. It feels like something I should have been able to get much sooner. And it led me to the sequence of questions that really lays the groundwork for happy. I mean, the first question was, is there a single person on earth who thinks that what I just went through is their dream version of mental health? And I wasn't being facetious. I really was trying to figure out, is this system, that this gauntlet I've been navigating, in place because people want it that way? Or is it just exist? And I really was trying to figure out, is there a single human being on the planet who, when you ask them, wave a wand and create your mental health solution from scratch, would have named anything that I had just experienced, particularly the experience with therapy. And I thought there may literally not be one person who would say that the most common just experience that we have today in America for mental health is their dream version of it. And I think that that's quite interesting, given that I thought at the time that was quite interesting, given that there were so many other areas of life where I think the solutions on the market really match up with people's dream version of it. I don't think most people can imagine an easier version of getting rides places than Uber. I don't think most people can imagine a better system for delivering goods to our house than Amazon. And as much as we, sometimes complain about these services, they've really created frictionless experiences that are, at this stage, I think, hard to beat. And so the next question I asked was, what is the dream version of mental health? And I couldn't answer for anybody else, but for myself, the answer was simple. I want my friends and family to check in on me more. And when I had to acknowledge that was unlikely to happen, the next question I asked myself was, what would be the next best option? And again, for me, the answer was simple. It was somebody like my friends and family checking in on me. And I was imagining my phone ringing, and a call that I had absolutely nothing to do to initiate. And on the other end was a really caring person just calling to hear my story, to hang on every word, to offer me comfort and really dive into, all the pain I was experiencing at the time, but also delve into my dreams and not the dreams I have when I'm sleeping, but the ones I have when I'm awake,
Sure.
and to help me achieve them. That was pretty clear to me. It was pretty clear to me at the time, rather, that was never going to happen. And it was a little heartbreaking to realize that, or to believe that. And then I started to wonder, like, why that would never happen. Because for something to be impossible, it has to be novel. And I couldn't think of anything novel about that, Sarah. Just somebody, a caring person calling me. Why is that so novel? Kindness, not new. Emotional support, thankfully rare, but not new. And the only thing I could think of was that it was frictionless. That was the single element of that experience that was novel, was that I was getting that support without having to take a single step. And then I started to wonder, is making something frictionless enough? Is that such a big deal that I'd want to leave everything else I was doing at the time and start a company around it? And then back to the connections earlier to companies like Uber and Amazon, I realized, yeah, Uber, you could say the same thing. Taxis are not at all innovative. All they did was make taxis frictionless. Amazon doesn't sell innovative goods. All they did was make buying frictionless. And I thought, isn't making mental health frictionless at least as important as making e-commerce and taxis and all the other things in our life that have become frictionless? And yet, as I looked at the market, I just didn't see any frictionless mental health solutions. The most frictionless services I could find still required people, like the National Suicide Prevention Lifeline or Warm Lines now still require people to be struggling and be aware of it and reach a breaking point and research what resources are there, and typically do the hardest thing of all, which is to actually reach out for support. And so I took this idea, just to wrap this up, to the Princeton Psych Department. There was a large group of people orbiting around it that were interested in this same question. And long story short, we ended up, having all kind of agreed that there was something there to this idea of frictionless mental health. We ended up, piloting early versions of this. And the most significant thing we did was survey hundreds and then thousands of people and ask them the same questions that I was asking myself and we were asking ourselves, namely, if we could wave a wand, what mental health solution would we create? And across the board, not unanimously, but overwhelmingly, we heard people say, Sarah, I want my friends and family to check in on me. They're not going to. And in the absence of that, I would like somebody like my friends and family checking in on me. And they were describing the same experience that I wanted, a proactive, non-clinical type of support, which makes complete sense, that people would want support that came to them as opposed to support that required them to take a lot of time and energy to access it. And they wanted something non-clinical, which also makes sense. When people are struggling, I've yet to hear a person struggling, and I've encountered thousands who say when they're really down, man, I would just love to spend a few weeks waiting in line to see a cognitive behavioral therapist.
Right.
Most people I know who are struggling say, man, I just wish I had someone to talk to, or that somebody would reach out. And so we went ahead, not seeing any proactive non-clinical solutions on the market, and reached the conclusion that at a time when our mental health crisis is spiraling out of control, it could be the case that the one solution people want most is not just underrepresented, but nowhere to be found
It is nowhere
in the country.
That's right.
And that's the lead up to Happy.
Mm-hmm. That is fascinating story. I had no idea that it had so many personal implications for you based on your own experience as well. And I do find the disruptive nature of the service that you're offering the most compelling part of it. The fact that it is non clinical, the fact that it is frictionless, I find it absolutely, it is truly going to change the way companies interact with mental health opportunities and create a culture of support for employees. I know that you have had tremendous experience with customers having great return on investment. And I'd love to hear a little bit about some of the tremendous results that you are experiencing.
Yeah. So I'll briefly say that Happy, just so the ROI makes sense, is really a few pieces. I mean, the main piece is frictionless mental health, and that is a nationwide network of non-clinical mental health providers among, if not the highest skilled mental health support network of its kind. That's non-clinical. These are nurses, social workers, people with extensive backgrounds in healthcare. And then we obviously have a proactive delivery model that allows us to support people who could be members of a Medicaid or Medicare plan, or more to the point of the workforce, it could be a workplace, employees of really any organization. We happen to be focused on large health systems, some of the largest in the country, the Department of Defense, Air Force, Army, and critically, for anybody to get support in any of these environments, they don't have to be struggling. They don't have to be aware of that. If they are, they don't have to reach a breaking point. They don't have to research their benefits. They don't have to connect their struggle to a benefit. No registration, no downloading an app, no opting in, no making an appointment, no waiting for an appointment. They literally have to do nothing. The Pentagon, with whom we're collaborating, refers to this as zero-step support. And when you deliver support like that to people, Sarah, amazing things happen. I mean, number one, leading up to ROI, you get very high adoption rates. And Happy has the highest, if not, or I'll say among the highest, if not the highest, adoption rates of any mental health service in the country. Not because we've been innovating in the actual support we're providing, the support we're providing, emotional support, it has been around since the beginning of humanity, right? That this is just undivided attention, compassion, encouragement. It's because of, obviously all the innovation in removing obstacles. So in a Medicaid, Medicare population, our adoption rate is 20 to 30%. In a workplace, it's 30 to 40%, which is much, much higher than an EAP, where you typically have adoption rates of 3, 4, 5%. And then we see clinical level impact, which means the same reduction in symptoms of isolation, stress, burnout, anxiety, depression that you'd see with a therapist. Sometimes Happy is doing this more rapidly than you'd see in therapy, because we don't have the same obsolete scheduling system that most therapists have. We're actually, when we encounter people, measuring how much support they need to stabilize, 4.2 hours, let's say, and we're giving people all that support right away. We generate more workforce intelligence than any employee listening or employee survey company in the country. Huge amounts of anonymous aggregated data that help employers fight turnover in real time, help health plans really address their members' needs in real time. And then the ROI comes from all that. So with a health plan, Happy's achieving, what in this case, the largest Medicaid plan in the country, almost an 8-to-1 ROI based on reduced healthcare spend. Just utilization of Happy reduces utilization of the emergency department, inpatient, psych, any self-insured employer would benefit from a service like this for that reason. And then with our employer partners, large hospitals, for example, we're showing mostly high ROI based on lowered turnover, significantly lowered. With one of the largest hospitals in the country, we're reducing turnover by close to 40%. And most of that's just the support we provide, but some of it's all the real-time analytics and our ability to help our partners quickly synthesize and respond to those data. So that, in short, Sarah, I would say in the workplace side, what's leading to such high ROI in some of our with some of our partners over 25 to 1, given how affordable the service is.
That's remarkable.
Yeah, but and it's mostly just helping our employers compress the time frame of their approach to turnover. I think there's a lot of companies that view retention, engagement, turnover as something tied to employee engagement surveys, which may happen every 6 months or every year, sometimes even less frequently. With our partners, turnover is something we're helping to fight on a daily basis, on a 24-hour time frame, which is the same time frame that employees are experiencing when they are deciding whether to leave or stay.
Mm-hmm. Absolutely. Absolutely. Those numbers are remarkable to me because they're double digits. They express a tremendous uptake or utilization of your service. Employees are responding, they're leaning into it, which I know many companies, generally speaking, have a 1 to 4% uptake of EAP services. And comparatively, that is just remarkable to me.
Keep in mind, Sarah, a lot of EAPs are designed not to be used or are specifically not being improved upon because a lack of utilization, the less an EAP is used, the more profit the company providing the EAP realizes. We had the largest health plan in the country. We're talking to a director of their behavioral health commercial line, and they said, when we were talking to them about friction, they said, "You're misunderstanding friction as a bug rather than a feature. If employees actually navigate this gauntlet and access support, that comes out of our bottom line." So it just has to be noted that the systems that we have in place that oftentimes are very hard to use, and it could be traditional models, but it could be digital apps that force people to download an app and register and do self-guided surveys and all, they all have the effect of reducing the number of employees who get support. And I'll just observe that if you understand the vendors, how they make money, you'd be surprised to understand perhaps that the more people who end up making it through and getting support, just the worse off they are, as in the vendor.
Right. I'd love to hear some, Jeremy, about what your biggest challenges have been in starting your business and how you've overcome them.
Sure. So, the biggest challenges, I would put them in two categories, Sarah. So one is it's hard to start a company. It could be a lemonade stand or Happy. Just any company, as you know, you're an entrepreneur, is hard to get off the ground. Well, one of the hardest professional things you could do, right, is just take something from
without
your
question.
brain to the back of a napkin to, that's all been covered elsewhere. I don't think it's all that interesting to discuss. If any listener wants to understand how hard it is to start a company, you can type that into Google, and I think it's been well covered. For us, I would say the more interesting challenge is very specific to mental health, Sarah, and it's really mental health and the mental health paradigm and infrastructure we have is very unique. And it's unique in a particular way. And specifically, there's a lot of sacred cows. People do not like to challenge old ways of thinking or even new ways of thinking that are ineffective with mental health because for a lot of reasons. I mean, one, I think we just recognize that this is one problem that does tie the whole country together. I don't think that there's very many people. It's a bipartisan thing to say that we're experiencing a mental health crisis. And mental health providers themselves. I know many of them, many of some of the most accomplished mental health providers in the country are on Happy's advisory board or service in other ways. And they're amazing people. And I think that for some of those reasons, and also just because, yeah, there's obsolete thinking in a lot of fields. It just bad ideas don't go challenged that much. And I think that has been Happy's greatest challenge is taking on both traditional and digital mental health, which are riddled with, in my view, bad ideas. As an example, Silicon Valley keeps spinning out and funding. This is just one example, new apps that are supposed to be the answer to old school mental health. And they are based on very, I would say, suspicious assumptions. Many apps, for example, require users to take a lot of steps to eventually get to a therapist and pride themselves on giving users access to every single possible mental health option under the sun, on the assumption that people are snowflakes, and if Sarah is not the same as her husband or me, and today Sarah may want, if you just take Sarah, may want peach flavored kombucha, but tomorrow she may want watermelon infused sparkling water. And we need to make sure Sarah has access to all this. And Happy has a very different position, and it's actually been hard to combat the idea I just expressed than has been to do anything else. Our assumption is that we're in a drought with respect to mental health. People are literally dying of thirst, and we need to make sure that people have water. And for us, the water of mental health is emotional support. And really, our mission has been not to maximize options, but to maximize adoption. And I think if you just look at two scenarios people face when they're struggling, since most people who are struggling have not downloaded apps, I think our model is self-evidently more likely to lead to somebody getting help. If you, Sarah, are struggling right now, think about in which of these scenarios you're more likely to get support. In one scenario, you have to download an app, okay? You have to register. You have to even know that there's an app to download. If you've gotten that far, you need to register, opt in, go through a lot of paperwork, probably do a medical history, self-guided assessments. It may be days before you can actually speak to somebody. Or alternatively, what if a call just came into your phone from one of the most caring people in the country?
The latter sounds amazing. And I do love your comment about bad ideas aren't challenged enough. We need to set aside time so that we can be more creative and think of new ways to approach old businesses so that we are actually disrupting an industry. And yes, just getting a phone call from a caring person sounds wonderful to me. It sounds like the barrier has completely been dropped from getting from where I need help to having help.
That's the idea. I mean, really, when we talk to our partners, it's interesting to ask them to imagine just how they would react if it were as hard to fulfill a lot of other basic needs as it is to get mental health support. Imagine to get toilet paper, they needed to go through all these steps, and it was days before they could get it. Imagine getting pizza required a lot of steps. And again, like nothing's coming for days. I mean, or water. I mean, it just is preposterous how difficult it is in the 21st century to get mental health support, but it's because of bad ideas. In fact, I'll say the baddest idea of all, the worst trend that still dominates in mental health, Sarah, as you and I have talked about, is just the over clinicalization of mental health. The idea that the DSM, we're all the ultimate catalog of mental health issues just keeps growing to the point where if somebody's feeling lonely after a divorce, they can get diagnosed with a temporary adjustment disorder, and this has real consequences. The reason this is so is that mental health clinicians are more or less in charge of mental health in America. And just like lawyers have a tendency, if they're just being lawyers, to write laws and coat everything in more rules and regulations, mental health clinicians, if they're just doing their job, have the tendency to keep clinicalizing the human condition, including very common emotional states. And the costs of clinicalization are really staggering. Every time we clinicalize an issue, it means that now it requires a clinician to treat it, and that clinician's hundreds of dollars an hour perhaps, and there just aren't enough of them, of course. So now it's going to take weeks to get there. You're going to have to fill out a whole bunch of paperwork, and you wonder why mental health is stigmatized. I mean, for anybody having to go through that much effort to get help and pay that much money, I mean, of course, somebody's going to think, wow, I must be really sick. And so, yeah, just a note on that.
And it's remarkable that a very simple approach can have such breakthrough impacts. And so, I'd love to shine a light on that, which is why we are talking today, because people need to wake up and understand that it can be a simple answer. It can be easy to access, and it can change your life.
I think so, Sarah. I mean, I would ask you not to turn the tables around, but I'm sure your listeners would appreciate hearing from you. I mean, have you ever had a struggle in life, without getting into the details of the struggle, where you had friends or family, just supporting you? I mean, where it didn't even involve therapy, but just your own support system came to the rescue?
Sure. And I've had situations where maybe I wish they could have been more available. So I completely identify with your story so very much. Life has a way of having many twists and turns. It's not a direct line. And there are many ups and downs that people experience in life. And having a service like you're offering, I can see how it would absolutely transform employees' attitudes and desire to deliver at work, because my employer is caring about me.
Yeah, I think that's spot on. I think you put it very well, Sarah. I would just say, if I had a choice between two employers, and one of them, and I really understood mental health inside and out, which most people, just don't think about it that much. But if I knew that they were just offering a standard EAP, and really what they were saying is, look, we care about you, not enough to offer anything other than, some of these wraparound services or an EAP that are going to require you to take dozens of steps and wait weeks to get support. Okay, if the choice were between that and an employer who said, I'm going to make sure one of the most caring people in the country is checking in on you every month and giving you unlimited support. Yeah, that, to your point, Sarah, does say something different about the employer. And that if that's their investment in me, it makes me want to much more significantly invest in them, in my work, et cetera. So
Absolutely.
you're spot on.
Absolutely. I'd love to hear, Jeremy, what are you learning now
God.
personally?
Yeah, I was going to say, do you want a 20-minute treatise on what I'm learning about contracting with the Department of Defense? I mean, I think what I'm learning personally is how important it is. Well, I'll say we refer to our providers, Sarah, as support givers, and they are among the most caring people, caring community I've ever met. And they do what we alluded to. They check in on, provide unlimited support to large populations of people every month proactively. And I think what I'm learning most through Happy, to be honest, is how important it is for me to be a support giver in my own life with the people I work with the people who I live with, are in my family, etc. As I've shared with a few people, nowadays, when I get into the car, instead of putting on a podcast or listening to music, a lot of times I'll just go through my phone, not while I'm driving, but at stop signs or stoplights, and check in on the people in my life proactively. And an amazing thing has happened, and this is people who I work with, family, friends, which is that when my friends and family have learned, I guess, from me in most cases, just how nice it is to have somebody check in on them. I'm not trying to share at all times what's going on in my life. I really want to hear what's going on with them. They start doing that to me, and what I've learned the most is really that for me, as important as personal development and self help and this whole craze, that you could put in exercise and all our new fangled ways of thinking about nutrition and meditation. Like, as much as I really, appreciate that, the journey that I find myself on most now is one where the arrow is much more clearly pointing outward toward other people. And I find myself getting excited about becoming a better listener, getting excited about learning the nuances of compassion and encouragement. And I still haven't met a single person in years who ever came to me and said, I've got to tell you about this new X, Y, or Z, this new, podcast I'm listening to or book I'm reading. It's getting me so excited about just supporting other people more effectively. It's always about something just that relates to themselves. And so that's what I've learned most. And I think that's not just a way to, build better relationships. I think professionally, personally, I truly believe that, and there's it's not just me. There's many people in the country, thankfully, I think, that are starting to do this kind of thing. But I think that, to me, is the beginning of a more supportive culture.
It absolutely is. And so clearly you are the best example of paying it forward in your own life, where you are sharing of the support that you might have longed for at a different time in your life, openly, without judgment, just caring about other people. And that is an art that we need more present in our society. People need to care more. People need to be more kind and literally be fully available and present in the conversations that they do have. Jeremy, what are your big goals and aspirations that you're working on right now?
Yeah, I mean, I think, professionally, it's really, I don't know, I guess personally and professionally, I would just say getting Happy farther off the ground and creating a more supportive culture is maybe the broader goal. You and I have discussed working on a very long book textbook now that's all about the set of ideas that surround happy and is meant to be a blueprint for creating a more supportive culture. And I think when I'm not stressed about the company, or one way that I actually escape from stress, which is inevitable to a startup, is by writing or doing writing the way I write, which is walking around the streets of New Orleans extemporaneously, trying to dictate a textbook into existence. And that's been a lot of fun, a lot of hard work. I can't believe how many people have written one book, let alone multiple. And but it's been a lot of fun to articulate all of these ideas that I find myself having more and more about just the importance of creating a more supportive culture, and really how, in light of recent events, just whoever is in the White House, whoever is in Washington, I really do believe each of us can, should, must do a lot more than we're doing to create a supportive culture. And I think it's a beautiful thing that maybe Happy, the book, and just through conversations like this, we can inspire people to do that.
Absolutely. So when will your book come out? Do you have a target timeline?
2090. No, I'm hoping within a couple of years. It's just about done as a draft. So now we're in a extensive editing phase, and there's some cool features to it. There's going to be a lot of submissions, I'll just say there's going to be not just my voice, but the voice of the people in this.
Wonderful.
A lot of the ideas that we're talking about are new, but they've been blowing in the wind for a long time. So yeah, we'll come back on when that book is out. We can talk about it.
I would love to. I would love to have a conversation about it. It sounds like you'll have essentially a multi-author situation where maybe there would be articles or a chapter by another person. Is that kind of what you're thinking?
I mean, I'm actually thinking that, we're going to write the whole book without any contributions first. And then with, all the different areas have so many submissions that we could completely remove our own voice from it and just have really a book by, for, from the people, from just ordinary people to experts, and show that as new as and important as these ideas are, they've been out there. I think we're just stitching them together in a very novel way that I hope has profound consequences, because I think I'm seeing those consequences in my own life.
I am certain that it will. Very, very certain. And so, Jeremy, is there any...
Thank you, Sarah.
Absolutely. Is there anything else that is percolating in your mind that you'd like to share today?
I think I would just mostly thank you, Sarah, for giving me a chance to talk to you about this. I know that you're as passionate about this as I am, and that really has come through in getting to know you. And if your listeners want to know more about this, about Happy specifically, or our approach, we try to lay it all out, more of an open source model. You can see more frictionlessmentalhealth.com. And I would just say on a personal note, as we go into Thanksgiving, and that's in the holidays, it's quite a time for a lot of people, that I would encourage your listeners to, I'm sure many already are doing this, to go in with the simple mission of making every interaction as supportive as possible. When you encounter people, family members, friends, strangers, set a little goal of doing everything you can to support that person, leaving them feeling as supported as possible. It really simplifies life, and I think makes it more supportive. And that's all I got, Sarah.
It makes everything better when you have a good conversation with someone that really cares.
True.
It absolutely makes everything better. There's no question about it. Well, Jeremy, I can't thank you enough for your time today. As we close, I would love for you to share if there is additional contact information. I know that you gave your website of frictionlessmentalhealth.com.
Yeah, I think check that out. Anybody can email me directly at Jeremy at frictionlessmentalhealth.com. And yeah, I would love to hear from any of your listeners, whether they're if they just want to talk more about this stuff. And obviously, you and I, Sarah, are collaborating, and I'm sure a lot of people may be interested in what you and I are trying to work on together. So yeah, we'd love to hear from people.
Absolutely. I can't recommend what Jeremy's doing enough, the power that it has to make an impact on employee culture in an organization, to make your employees want to stay and lean into your organization. It could even increase company revenue, which is a mind-blowing possibility when you're talking about mental health. But I very much appreciate your time today, Jeremy, and I very much look forward to hearing comments from listeners. Thank you so much for listening to today's episode of Transformational Thinkers with Sara Sheehan, where I interviewed Jeremy Fischbach, CEO of Happy. We explore the critical inefficiencies of traditional employee assistance programs and how Jeremy's approach is revolutionizing the industry. Here are the 3 big takeaways from today's discussion. First, frictionless support systems. Jeremy discusses the importance of removing friction from mental health support services. His company, Happy, offers proactive, zero-step emotional support, ensuring employees receive care without the burden of navigating complex systems. The model boasts significantly higher adoption rates compared to traditional employee assistance programs. Second, ROI and workforce retention. Happy's innovative approach doesn't just improve employee well-being, it also results in tangible benefits for companies. By providing real-time emotional support and data analytics, Happy has demonstrated high returns on investment, including an 8-to-1 ROI for a large Medicaid plan, and a remarkable reduction in workforce turnover by up to 40% in some organizations. Third, simplifying mental health care. Jeremy critiques the over-clinicalization of mental health, which often increases stigma and complicates access to care. By offering non-clinical supportive interactions that mirror the care of friends and family, Happy achieves clinical level outcomes in a simpler, more accessible manner. I can't thank Jeremy enough for giving me some time out of his busy schedule. I feel like he truly is on the path of revolutionizing access to mental health in large organizations and the return on investment in mental health, truly disrupting the industry. And I would be remiss if I didn't mention, please subscribe and never miss an episode.